The White House announced the nation's most sweeping national strategy ever for fighting HIV/AIDS yesterday, an effort that aims to cut infection rates by 25% in 5 years. It does not, however, call for additional funding, and that has drawn criticism from some AIDS activists. Frank Oldham Jr., the president and CEO of the National Association of People with AIDS, joins us this morning with more. Welcome and good to see you. Thanks very much for your time.
Thank you very much.
Talk about the initiative rolled out yesterday by the White House. What are your thoughts about it?
Well, President Obama and his administration, his director of the Office of AIDS Policy, Jeff Crowley, rolled out the most historic, boldest plan to fight AIDS in the United States. We were one of the few countries that did not have a national AIDS strategy for over 2 decades. Countries in Africa have AIDS strategies, national AIDS strategies. So President Obama has made a historic progress and benchmark for people living with HIV and AIDS in this country.
What are the pillars of the plan?
Prevention, make sure that we reduce infections, make sure that people are tested and know their status. NAPWA, my organization, National Association of People with AIDS, founded National HIV Testing Day. We're positive people who want people to know their status, protect themselves and protect others. So it's testing, it's getting people connected, quality HIV care and treatment services, and also addressing some of the other disparities that exist, such as a lack of lack of housing for people, poverty. All those issues are all rolled up into the issue of AIDS.
In the early days of the epidemic, people could acquire the virus that causes AIDS, I don't want to say accidentally, but clearly in the early days there was so much less known about the exact mode of transmission. Nowadays we know a lot, and a lot is taught in the schools at a pretty young age. Why, some might ask, are there still any new infection cases?
Well, one thing is that 20 to 25% of people who are living with HIV don't know they're infected. So they are not aware they're infected, and of course that increases infections. People who know about their infections, people like me who are HIV positive, we actually are the norm is that we're very, very careful about risk reduction. We like to inform people about our status and protect ourselves and protect our partners.
But there are still, obviously, people out there not taking the appropriate precautionary steps because, you know, in the perfect world, everyone would take those steps and we wouldn't have new cases.
Well, 2 things that are needed there. Increased efforts around HIV prevention. One thing that's happening at CDC that is dynamic is that Dr. Thomas Frieden, who was the Commissioner of Health in New York City, is now the director of CDC. He created cutting-edge programs such as syringe exchange to reduce infection rate among intravenous drug users, condom distribution, widespread condom distribution, widespread prevention messages, and his commitment to fight AIDS stigma. So Dr. Frieden is appointed by the President. That's a dynamic change for us.
A lot of people are talking about testing being far more routine, more frequent than it is right now. You support that, I
Absolutely. NAPWA was the first organization to support the CDC's recommendations around voluntary testing, HIV testing in medical settings. We need to have increased testing. It needs to be testing, opt-out kind of testing that's automatic. Everybody needs to know their HIV status and be able to protect other people. Otherwise, we're going to continue to have these increased rates.
Even before the administration came out 24 hours ago, whatever it was, with this bold, as you describe it, AIDS strategy, you had a release and an alarm, if you will, about funding issues. What is your concern about AIDS funding?
Well, the AIDS Drug Assistance Program, and that is a critical program for people living with HIV and AIDS. NAPWA represents 1.2 million people living with HIV. There are waiting lists. There were waiting lists in about 20, 30 states in America of people who could not get life-saving medications because the program that they depended on had run out of money. Well, as of 2 days ago, the Secretary of HHS and the administration, President Obama, put $25 million in to address those waiting lists right away and to make sure that we don't have an emergency like that. However, we do need funding. It's about $126 million, not much in terms of the federal budget, to save the lives of people living with HIV/AIDS.
This is a call to Congress, then?
This is a call to Congress. Congress needs to act. And Congress has some great leadership in terms of Congresswoman Barbara Lee and others who are really fighting for this legislation.
We only have 15 seconds left. The evidence is overwhelming. if you're on the right drugs early, the results can be quite positive, quite good.
Absolutely. I'm an example of that. I've been positive for 25 years, and I encourage people to take their medications and live full lives.
Frank Oldham Jr., President of the National Association of People with AIDS, based in Silver Spring. Thank you very much for your time.
Thank you,
Appreciate
Bruce.
very much for being here. Come back and be